everybody. Welcome back to the Energy MD podcast, where we help you resolve your long COVID, chronic fatigue, ME/CFS, and MCAS so that you can live a better life. So excited today about speaking with my friend, Dr. Beverly Yates, because we're going to be talking about the Yates Protocol and diabetes and fatigue. So let's learn a little bit about Dr. Beverly. So she is a licensed doctor of naturopathic medicine and the nation's leader in online type 2 diabetes care. Her virtual practice has programs and supplements to help people lower their blood sugar naturally at home without ever having to step foot in a clinic. I love that. She is the creator of the Yates Protocol, 5 practical, enjoyable steps to reversing type 2 and prediabetes and living the life you love. Her training as an MIT engineer turned doctor inspired her to tackle the diabetes crisis. She's helped thousands of people restore healthy blood sugar levels and heal from the damage of diabetes. And she's been seen multiple times on TV. Bev, thanks so much for joining me today.
Hey, you're very welcome, Evan. Thank you for the invitation. I'm happy to be here and have this discussion with you and hopeful to be a helpful partner with you in helping people reclaim their energy and be able to live that life that they love.
Yeah, and blood sugars play a big role in that. So let's kind of get back to basics here. So how do blood sugars play a role in energy?
Yeah, that's a great question. Let's start there with this discussion. Blood sugar is what your body uses, also called glucose, in order to fundamentally provide your energy. So you can get up and out of bed in the morning, be able to get through your activities for the day, to do your work, do your chores at home, live your life, have a relationship, all of the things, right? Your self-care. And when your energy is compromised, if it's disrupted, if it's out of balance, you really got a problem, a fundamental problem.
Yeah, so then blood sugars affect our ability to make energy, right? Like they affect the mitochondria in some way. How does that work?
Yeah, mitochondria, one of my favorite things to talk about. It's funny, it's really been in the news lately, which I'm glad about. So we may or may not have learned, hopefully we did, in high school biology, that the mitochondria are in all of our cells and that they are the energy powerhouses, so to speak, of the cell. And the thing that's so interesting about energy and energy conversion is your mitochondria make ATP and they're brokering it and all the good things happen. But if there's a disruption there, if you have compromise in your mitochondria, your experience, your lived experience of your energy will not be the same. You're really going to struggle. And it's one of those things where, shoot, Evan, a lot of times people are blamed for their illnesses and they're blamed when they're fatigued and they're blamed when they don't feel well. And they're like, well, why won't you go and exercise, 5 days out of the week? Why don't you cook your own meals? Why don't you, the whatabouts, right? Just lots of finger pointing, blaming and shaming. But when someone's exhausted, oh, come on, let's get real. It is so hard to do those really, really basic things. In fact, that should be a red flag. The fact that the person is struggling to do those basic things really should tell you something's broken. It's not all in their head. They're not making it up. There's no secondary gain from this. So with that in mind, your blood sugar is a very key component of your energy. You need to have enough blood sugar in the right places, doing the right things. You definitely don't want too little blood sugar and you don't want too much. You want to balance them out.
Sounds good. It sounds like the Goldilocks dose, right, of blood sugar. Yeah.
Yeah, pretty much.
So then how does somebody know? And we're talking about blood sugar. Well, let's talk about what's the difference between like a blood sugar issue and diabetes.
Okay, so there are blood sugar issues that are not diabetes. Diabetes would be technically defined, particularly if it's type 2 diabetes, of a hemoglobin A1C, commonly known as an A1C lab test, of 6.5 for a number or higher. So 6.5, 7.2, 8, 9, 10, etc., right? So that's A1C. Pre-diabetes is the range where an A1C is measured at 5.7 to 6.4. So it's the stage before something is formally diagnosed as type 2 diabetes. Now, I want to make an important distinction so people don't get confused. Type 1 diabetes is autoimmune in its root cause. It means that the cells have been attacked that are in the pancreas that make insulin, and therefore that person can no longer make their own insulin. Insulin is the key hormone that interacts with glucose in order to keep you healthy. If someone's a type 1 diabetic, they need to be on insulin taken from the outside, whether it's injectable or from a pump or however they're getting their insulin for the rest of their life. Right now, we don't have a way to bring that pancreas back to life yet. I'm hopeful though. There's been some new technologies in some other arenas that, like CRISPR for, let's say, sickle cell anemia, that are just amazing to me that that's even a possibility. But right now, that's the deal. With type 2 diabetes, typically certainly pre-diabetes, but typically with type 2, people are not on insulin replacement therapy unless they are really, really high for an A1C of like a 9, a 10, or 11 and in the danger zone. So those are some important distinctions to know.
And the role that insulin is playing with these blood sugars, like why would some of those people need insulin?
Yeah, people would need the insulin because, your glucose needs to be carried, so to speak, or transported into the cell to make it available for energy. So your blood glucose is literally in the blood, your blood sugar is in the blood, and on the cell wall are these insulin receptors, and insulin grabs up the glucose that comes along and takes it and brings it inside the cell to make it available for energy. If you have chronically high levels of blood sugar, it can overwhelm, if you will, the ability or capacity of your insulin to be able to do its job. And as such, you get into a state that's often called insulin resistance. If you're not insulin resistant, if you've got healthy blood sugar levels, that means you're insulin sensitive. Those insulin receptors on your cell aren't overwhelmed and are able to effectively grab up that extra glucose or normal amounts of glucose, excuse me, in the bloodstream, bring it inside the cell, make your energy available. If you have chronically high blood sugar for too long, what's going to happen is insulin is becoming more and more resistant, less effective or insensitive. And as a result, then that extra blood sugar will start to be stored as fat, typically in the liver and then around the belly. So then you get the problems with the visceral fat or belly fat, abdominal fat, and can be off to the races with a whole host of other problems because of all the inflammation that causes.
And when you were talking about diabetes and pre-diabetes, and you were mentioning those numbers of A1C, those are determining the amount of blood sugar that's kind of floating around in the body for a period of time. Is that correct?
Yeah, to some degree, it's an average number. It's a snapshot. Typically your red blood cells are going to turn over every 90 days. So think of it as quarterly. Like if you have a business or if you're in school or something like that, there's definitely a quarterly rhythm to the year. And so every 3 months, you get a whole brand new fresh set of red blood cells. Your bone marrow is making those red blood cells for you. It's a beautiful thing. You don't have to think about it. It just happens. So if your A1C is checked multiple times a year, you're getting a snapshot of what's the average exposure. I'm going to emphasize this. We're going to talk about some other blood sugar problems in a moment. It's the average exposure of the red blood cells specifically to glucose, is that's what they're looking for. So in that assessment, then if you have a higher A1C, it says that your baseline, instead of being at a healthy level of blood sugar, it's getting higher, higher, and higher. It's getting too much as you go from pre-diabetes to type 2 diabetes. So your glycemic control is not the same.
Hmm. And this doesn't happen overnight for people to get to type 2 diabetes, right? So what does that progression look like from birth?
Yeah. So typically, back in the day, when you and I were in our respective medical schools, and before then, it was not an overnight progression. This was typically something that happened to people who were older, like in their 60s, 70s, 80s, right? These days, we have kids as young as 8 being
Mm.
diagnosed with type 2 diabetes, which is shocking and absolutely not sustainable for human health. We can't let this get worse. We just can't, right? We won't thrive as a species if we have this international phenomenon just completely continue to run amok. Um, Having said that, the typical progression for people is that it might be something where prediabetes used to be didn't show up until 50s, right? At the time when everyone's hormonal balance was shifting. You leave the more active reproductive phase, right? Women absolutely do in their 50s. Men, I would argue, with andropause or have a different shift pattern, but it's a shift. It's not the same, right, for fertility. And now frankly, it's kind of 20s, 30s, teens, it's amazing to me how much younger the shift has become for type 2 diabetes or prediabetes. It's just not sustainable. We can't keep this up.
And so is it just from eating a different kind of diet? Are there foods that people are eating that are causing this?
There's multiple factors. So a fast way to get type 2 diabetes, for instance, can be certain viral illnesses. They can cause it quickly, even though the person eats well, gets great sleep, has good meal timing, they're exercising, they're not stressed. So a viral origin specifically for type 2 diabetes is a possibility. So that's one, that's a quick path. Another one that can happen is for nutrition is that someone is eating a lot of fast food or junk food or highly refined ultra processed food because there's no nutrient density, right? They're literally starving in an interesting way. They have lots of calories, but they're starving for nutrients. It's that odd paradox that we get where people eat a lot of the foods from the Western world, and when we transport that around the world, unfortunately, the diseases go with it. That's another, root cause etiology. Another one can be like severe stress and trauma. That absolutely can happen, whether it's one big whopper kind of stress or it's multiple hits. You'll see people who are first responders, for instance, who will definitely show up more commonly with type 2 diabetes, for instance. You have people who have the personal habit of they just want to eat fast food. They prefer it. They could afford healthier foods. They could actually cook for themselves. They've chosen not to. They got into an unfortunate habit and now it's going to bite them in the butt, right? Another root cause issue could be poor sleep for whatever reason. There's lots of reasons people's sleep gets to be messed up. That can result in type 2 diabetes. A classic one, and that might be really familiar to folks here in this community, would be issues with sleep disorders like sleep apnea. That absolutely can cause type 2 diabetes. If someone is overweight or obese, that also can cause type 2 diabetes. The inflammation that you get from the sleep disorders or that you get from the obesity or extra body weight, particularly held in the abdominal area, puts someone at more risk for diabetes. And that's why sometimes if you solve one problem, you can solve the other problems because they're related,
Hmm. Yeah, and when you're talking about stress, oftentimes we're talking about how stress is affecting the adrenals and how the adrenals and cortisol and other hormones are affecting insulin. Can you talk a little bit about that interplay?
Yeah, so that interplay is really an interesting one, and I don't think that it's talked about enough. When we are stressed, there is a normal natural release of extra cortisol, so we can respond to the moment. I think of cortisol as being the hormone of the superhero, right? That's where you hear the story of like a 95-pound woman picks up a car off her kid or something like that, right? Um, a more petite framed man is able to do these amazing things. Like there's someone in danger and he leaps this really tall fence. He's not an athlete, but he's able to rise to the moment and do it. That's cortisol and adrenaline partnering, right? Got a hormone and neurotransmitter doing beautiful things for a moment. In today's world, sometimes we are so stressed chronically, it is the steady beat, unfortunately, for a lot of people. They don't have enough recovery and rest time. This means then that cortisol that was meant to be helpful for a moment, it does have you release more of your glucose, your blood sugar. They should happen together because you're in superhero mode, you need your energy, you need your blood sugar. These two are partners. The problem is if your cortisol levels, instead of being at a normal level, get pinned high, then here comes your blood sugar. It was at the normal level. Now it got pinned high too. They're going to track together. So for some people, stress and the extra release or the chronically high release of cortisol can get them in trouble. And the next thing you know, now they start to suffer with problems with glycemic dysregulation or a lack of good blood sugar control. That's another place it can break. People who eat really late at night and eat big amounts of food, particularly unhealthy kinds of foods, or who are constantly snacking, that's another way that you can get into the large pool, unfortunately, of what leads to type 2 diabetes. These are all possibilities.
Hmm.
You
And
cannot
so
exercise this one either.
you can't out exercise it?
Nope, just like the personal trainers and athletes will tell you, you can't out exercise a bad diet. The thing I've observed is that you can exercise all you want. If you don't take care of the other steps that are a part of, what I've packaged up as the Yates Protocol, you're still going to have diabetes. You cannot
Hmm.
beat it with just exercise. You have to take care of what you're eating, sleep, stress, meal timing. You just gotta. People don't always want to hear that, but that's the truth. The good news is two or three things are what's going to matter there, right? So you want your energy to be organized. You want that mitochondrial cellular energy. You want your blood sugar energy in the right places so it could do the right things for you.
So let's dive into the Yates protocol. Tell us about it.
Yeah, so over the years, I initially started my work working with people who had problems with their gut, people who had problems with their heart. I did a lot of work with people with cardiovascular things like congestive heart failure and atrial fibrillation and things of that nature. People who were really stressed, they were having sleep problems. And over time, I noticed in my clinic, I'd say in the early to mid 2000s, this steady increase and then a big increase of people coming who had prediabetes, type 2 diabetes, excuse me.
Hmm.
And for the people who had all of these blood sugar problems, they had PCOS, polycystic ovarian syndrome, I was like, this is an interesting change because, before in the 80s, 90s, there was this big increase, at least in the US, in heart disease, cardiovascular problems. Then I saw the shift, boy, was it a shift towards these issues with diabetes. And so I came to understand that it was no longer the old 1950s advice that frankly actually goes back to 1915 around eat less and move more. It was not adequate. In fact, it was insulting because, in today's complex, busy, stressed out world, there's a whole lot of people who are eating less to the point where they're starving themselves, frankly, and they're exercising sometimes 2, 3 hours a day in a gym. They aren't having good success with this blood sugar problem. I was like, well, that's weird. What changed? Well, you think about it, our background, right? We have some things in the news right now. They're talking about these forever chemicals, PFAS, so toxicity in terms of our background chemicals has changed. The quality of our food supply is crap. It's much lower. I would argue that our grandparents and great-grandparents had higher nutrient density in many foods than probably wouldn't need to be labeled organic because they were. you know and if you'd said to your great grandmother or to your grandfather, oh, I'm going to have some grass-fed beef, or oh, I'm going to go get organic celery, they would look at you like, what's wrong with you? Of course cows eat grass. Did you fall and hit your head? Like, what is wrong with you? Or the celery organic, what are you talking about? Like, I could just picture my great grandmother, right? I was gonna have that conversation. That we have changed this planet. And I think that one of the contributors we don't talk to enough about diabetes has to be toxins, environmental toxins, whether they are man-made or a cluster of naturally occurring ones. We really got to be on our game these days if we want to be well. We don't get a free ride a lot of times for that.
Yeah, so in the protocol, you've got a number of steps, right? Can you take us through
Mhm.
'em?
Sure, sure. So nutrition is going to be the bullseye of the target. We have to be sure that not only you're eating a healthy diet, but that your nutrition is nutrient dense and that your body likes those foods. And by like, I mean you're eating things that are friendly to your blood sugar and that you are not having unusual blood sugar responses to otherwise healthy foods. One of the things I've come to understand and see, because I work with people often and we use CGMs, continuous glucose monitors, and software and apps so we can really look at their lifestyle elements, look at, their sleep, their exercise, their moods. It's become really clear to me some people are having unusual reactions to otherwise healthy foods. So something like cauliflower or blueberries or quinoa, they can sometimes be provocative and cause that person's blood sugar to spike. These are otherwise healthy foods. Most people don't have a problem, and a generically healthy list of foods to eat works for many people. There's a substantial number of people who, that's absolutely not true. What if spinach spikes your blood sugar? That sounds crazy on its head.
Hmm.
But if it's happening, you need to know. If you have food sensitivities, food intolerances, those sometimes correlate 1-to-1 with moments if you have a CGM to see a blood sugar spike. And the reason I call it the CGM is because we get more continuous real-time data. It's so painful to get that drop of blood, put it on a test strip, stick it in a glucometer. Most people stop doing regular testing who are type 2 diabetics or who have pre-diabetes because it hurts. It's painful. Ouch. Nobody wants that, right? A CGM is so much easier. And unfortunately, it's not considered an over-the-counter medical device in the US, and so you need a prescription. So you need easy ways to get access to a CGM. But anyway, if you can get that data, it's actionable insights are right there for you. So you'll know, or whoever you're working with, your health professional can guide you on that. So nutrition, that's key. It's not the only player, however. Next, I would say, which is really underappreciated, is going to be meal timing. Sometimes people who have type 2 diabetes have a set of habits that I'm going to call out here. And it's not because I'm trying to be judgmental. I want people just to be aware. Often they'll eat breakfast, which is great. We need to fuel our brain and get ready for the day. They skip lunch, and it's not on purpose. Often life just gets away from folks. They are busy at work. They tend to be the rock in their community. They're the one that's the go-to person to get stuff done. That might be true at work. It might be true in a place of worship. It could be in their neighborhood, whatever it is. And this means then that self-care is missing. And so they don't have a plan for lunch. They get busy, they get stressed, they get some surprises. They haven't eaten lunch. They've gone too long between breakfast and dinner. By the time they get to dinner, the desire to eat healthy and the wherewithal, if they don't do meal planning and have those good habits in place, they're far more likely to reach for something that's going to be immediately comforting and satisfying, but maybe isn't the best for their blood sugar. It's just a real risk, and can lead to a spiral, unfortunately, a downward one there. So that's 2 steps, right? Nutrition, meal timing. Next one I'm going to prioritize is sleep. I don't think people are aware how much sleep is a beautiful invitation every night to hit the reset button. to restore, to recharge, to do the repair. Your gut, so many things in your body are doing all of their cleanup work. Your brain in your first phases of sleep is literally washing itself and getting rid of any leftover gunk that can help you avoid things like dementia and Alzheimer's. So if your sleep is compromised, this is actually a big deal. Sleep is when your blood sugar should reset and should go back to a healthy, normal range if it wasn't already there at bedtime. So when you awaken in the morning, your fasting morning blood sugar numbers ideally should be around 75 to 90. Many would say 70 to 99. I'm not going to argue fine points, but we don't want it too low and we don't want it over 100 either. Otherwise, that A1C now is going to creep up. So that's another, opportunity to look at, hey, what's my blood sugar doing? Is it good for me or not? Then your next partner here for healing is going to be looking at stress. As we've already alluded to, stress with the release of cortisol and adrenaline will cause your blood sugar to rise. And if you have chronic stress, if you've had trauma, this is absolutely a potential vulnerability. And so you've got to address that. And then finally, we're going to look at exercise and strength training. And I always share with people the concept that strength training, because I emphasize that of all the options for exercise, because it helps us avoid falls as we get older. It helps us to optimize our blood sugar. That active working muscles are blood sugar sponges. It's an easy way to get a hold of your blood sugar. So
Excellent.
with that in mind, yeah.
So nutrition, mealtime, sleep, stress, exercise, and strength training. That's the 5 steps.
That's the 5 steps. And the good news is for most people, usually it's 2, maybe 3 they have to pay attention to. It isn't necessarily all 5. Because if you have great sleep, for instance, and you're eating well, chances are your self-care is going to be a lot better. And then you can notice what stresses you and deal with it. You're going to have the motivation and energy to exercise. You won't be so exhausted. And then on top of that, you're going to keep that rhythm around your eating. So if it's breakfast, lunch, and dinner, or if it's simply lunch and dinner, whatever you feel best and most consistently energized by, you're going to do that, right? I had an amazing experience recently with a patient, and she did such a great job. Pam is one of the people who inspires me. And so in her case, when she first sought out care, she was over 25 years dealing with type 2 diabetes. It has been a long, long, long struggle. And I say good on her for reaching out and not giving up, right? So she gathered her courage and asked for help, and we started to work together. And in her case, she had some issues with sleep that she had addressed and successfully resolved. And so yay, because that can be a tough one. But she noticed how much her feelings around depression, not necessarily anxiety, in her case it was depression, and a profound sense of fatigue, Evan, just profound fatigue. And I know you can appreciate this with your expertise, right? She just didn't want to do anything but sit. Even though she knew she needed to be up and be active, she had intellectual information, she had a desire, but couldn't get moving. And because her exhaustion was so profound, we worked initially with some supplements. I was hopeful of being able to spark that energy to get her going. So therefore, the rest of the pieces would come along. And after about a month and a half, she had a big turnaround. Her energy came back. She went to the gym. She hired a personal trainer. She started to work out. Simultaneously with that, she looked in her cabinet and she said, I'm always craving crackers and crapola. I got all this stuff in my cabinet that I know is a problem. She got rid of it. And she literally said, I went from craving crackers and crapola to craving 3 bean salads. And because we worked in her case, that root cause issue, I felt with my assessment was her energy, rather than say, oh, you're bad, you're not exercising. Oh, you're bad. No, it's not helpful. If it was just blame or shame was an effective treatment option, nobody would have these problems, right? Nobody. So it's not helpful. It's not respectful. And look, we got to, as clinicians, do better by folks, right? And assess what's really wrong. She clearly was motivated. Why would someone reach out and ask for help and then not want to do it, right? That's silly. So she did the things. So the biggest changes for her were around her energy, therefore led to the interest in the exercise and strength training. And with that energy, she was feeling better. She was more socially engaged with her family and friends. She was feeling happier, right? She looked at her nutrition, realized it was a hot mess and she needed to be responsible for it. And she took the steps. She bought into the whole idea of doing meal planning. That made it a lot easier for her. So then when life threw curveballs, because life throws curveballs, unless you live in a bubble, life throws curveballs. You get surprises. You get a phone call, maybe that a loved one has died. You get a phone call that a friend's in trouble, whatever it might be, or a text message or a DM on Facebook, or however you communicate these days. And with that, was able to respond. And you know what the beauty of this was? She didn't get off track. Why? She had her energy back. It was central in her case for recovery. Now, this is a woman who had been dealing with this for over 25 years. Because most people are like, you've got it. You'll be okay. Everybody has it. That we shouldn't normalize sickness,
Hmm. Yeah, I appreciate you sharing that. So, for those of you out there who have blood sugar issues, who have diabetes, it can be a significant cause of your fatigue and has to be remedied. So then well, I guess the first question is, how do people know that they have a blood sugar issue? And then, and then, I'll answer that first, and then we'll go into how to fix it.
Okay. So one of the most problematic things about blood sugar issues is that often, at least in the early stages, they're silent. Some clues you can have, I'm going to share these, are things you can observe about your own body. You may notice that your skin becomes a darker color than whatever is your normal natural baseline color, particularly around your neck, especially in the back of the neck. If you see that it's gotten darker, or you look in a mirror, if you live alone, other people can look and observe that just get that feedback, or use your cell phone, selfie mode in a mirror, and you can look and see what's going on in the back of your neck, right? I just want to make sure people have thought through, how can I look back there? And notice, have the skin color changed? Do you have the accumulation of what are called skin tags around your neck collar, where there's little outpocketings of skin tags, right? That's a key sign of insulin resistance, and often the onset of prediabetes or type 2 diabetes will be marked by that. Similarly, these same skin tags you might notice in your armpits, no matter how hairy they are or hairless. Look in your armpits. Do you see skin tags there? Do you see darkened skin color patches only in your armpits? Let's say back of the neck, those are two spots. Your third one is going to be in your groin area. And move, if you are still quite hairy in your pubic region, pull them apart and look and see, has the skin changed color? Is it substantially darker than what your normal natural baseline color is? Those are great signs that something's going on. I know it's not common, at least in the US, for everyone to always be assessed for their fasting morning blood sugar number and for their A1C, but I would advocate everyone should be checked at least twice a year for this. Those lab tests are cheap. We're talking $3, $4. There's no reason to not have them done. People shouldn't be held hostage about data from their own body.
And so when somebody realizes that they have an issue, I mean, the thing is that the remedy, or at least we're going to go into diet at this point, like everybody needs to be doing this, right? If you don't eat a good diet, you have the potential of getting blood sugar issues, prediabetes, diabetes. Is that true?
Yes. It's a risk. It's definitely a risk. Yeah, cravings could be another symptom people might experience, particularly if they have poor sleep or lots of stress. They're far more likely to have cravings, whether it's for sweets or it's for high calorie, savory, umami kinds of foods. They don't just want one serving, they want three. That's a sign something might not be right with your blood sugar.
Hmm.
And
Yeah.
then, of course, gaining weight, and maybe your weight gain doesn't make sense. You're not on corticosteroid medications or something like that.
So then what do you recommend for people to choose when it comes to food?
I think you should start with looking at your plate and what's on it and what are the proportions. I'm always a fan of having people focus on eating leafy green vegetables with every meal. Yes, this includes breakfast. That's the hardest one for people to do. I will admit that straight up. I do it. I don't have the problems, but I have a family history that is profound. My father's side of my family is diabetes has been a complete wrecking ball. So I'm doing what I can to manage genetic vulnerability, right?
Right.
Making sure your plate is at least half leafy green vegetables. Then for the remaining half, you're going to have a quarter that's left, like think of it as like slices of a circle here. So half of it's going to be leafy greens. A quarter can be your healthy proteins, things that will burn evenly and long because we don't want blood sugar rocket rides, like, the highly processed, ultra refined things like cookies, cake, biscuits and gravy, particularly power combo that could be problem, things like that, right? And then the remaining quarter of your plate can be the healthy fats and other foods that we want to emphasize, right? So we've already gotten the fiber portion, we've already gotten the protein portion. Now we want to look at the healthy fats and the slow burning resistant starches and carbs. That can be nuts and seeds. We can absolutely focus in on beans, peas, and legumes. There's many different kinds. If you have a lot of gas or farting or flatulence, rinse your beans and give them 2 soaks. That makes a huge difference in the amount of potentially combustible material so that you aren't embarrassed all the time. But the beans are neatly packaged, right? They've got your carbohydrates in there, you've got your protein, you've got your fiber, they've got all the nutrient density you could want. My favorites are lentils and chickpeas. I find those are the least likely to cause people to have a lot of gastric distress or to do things that are embarrassing when they are around others. Those are the things we focus on. And then if you're going to eat grains, I'd say check your blood sugar. If you have access to a CGM, please get one and see if you're okay. Some people can have grains, whole grains, and be fine. So that's going to be brown rice, wild rices. Um, Oats for some people are fine. For some people, it's a disaster and they shouldn't eat oats. That's where testing and finding out what your blood sugar is actually doing in response to your food is invaluable. Because a lot of times diabetics are given the advice to start off their day with just plain oatmeal. Well, for a lot of people, that's a blood sugar rocket ride. It's not actually a good idea. So test, don't guess, find out what's going on for you. I would de-emphasize grains unless you are testing and know you're okay. And it could be portions. So some people are okay with a half cup, let's say, of any of the grains. Other people, when they go to a cup, it's borderline okay. And maybe they go to 2 cups, it's too much. Their blood sugar goes crazy. So always consider portions for any of this.
And if somebody is using a continuous glucose monitor, what is abnormal for an increase?
Generally, when you eat, your blood sugar will probably rise if you're in a healthy zone already, about 25 to 30, maybe 40 points. If you see your blood sugars rising 50, 60, 100 or more points, like it's really going up there, you got some work to do. And these days, CGMs are a smaller profile. And now, like with the Freestyle Libre 3, and I think Dexcom is coming out with the 7 or 8 right now, they are continuous data. So they give you real-time data. In other words, you don't have to take your phone and swipe the back of your arm in order to get the information via Bluetooth to the device. It's always communicating to your phone, which is really awesome. So when you're asleep, you'll get all the information what happened when you were asleep, for instance. If you were feeling stressed, if you got into an argument, if you're someone who is like a Navy SEAL or professional mediator or a lawyer, you might find that conflict does not stress you. Your blood sugar is not going up. Someone else is a preschool teacher and they love being around little kids who are yelping and yowling. We all have different things that we enjoy and things that drive us crazy. And so your blood sugar might reflect that for you.
And so those CGMs, how do they read the blood sugars? Are they just sitting on the skin and they're like some infrared scanning, or do you actually have to put a needle into the skin?
They are working on infrared scanning, and I can't speak to that just yet, but it'll be breaking news for the technology. We're keeping an eye on that one. Right now, for the ones that I know of, they have a needle in them. So when you take the CGM out of its packaging, right, it's sterile open, obviously I've looked at this one before. You can see there's a needle here in the center. And so when you put it over your skin and you push down the plunger, it's going to inject that needle for you. You might feel a little pain, a little stick then. It's mildly just a slight momentary pain, or you might not feel anything. It really depends on whether or not you've hit a surface nerve. And it has adhesive around it, so it will stay put. So you can shower with it, you can swim, etc. Follow the directions the manufacturer has supplied, rather. They will tell you what the parameters are. And in that, it is checking, actually assessing the blood sugar levels in your fat cells, not in the bloodstream. I want to make that distinction. So when you get a drop of blood from a finger stick and you put that right on the finger, you took the drop of blood from the finger stick onto the test strip and into the glucometer, that's reading the blood. If you use a CGM, it's actually assessing the information from a fat cell. So the delay is about 15 minutes in the data. So it's showing you something from 15 minutes ago. So I want to be sure people understand. There's a little time lag there.
So when you eat food, you just have to take that into account.
Yeah, yeah. So if you have, like, say, a coffee drink from, one of these major mega bucks corporations, we'll just name it that for now. And you have something that's like, a latte or a frappuccino or whatever, name they're calling it, you might want to see what your blood sugar is doing. You might be surprised. It might be like a soda for you.
Right. And so when you talk about beans and you're talking about rinsing beans, is that also soaking beans?
Yes, do 2 rinses. Same if you soak them and you're going to cook them on your own, either, on your stove top or in a pressure cooker. Do 2 full rinses if you struggle with a lot of gas and farting and flatulence. It really can help.
So is a rinse just putting it under the water and letting it rinse, or is it sitting in the water for a period of time?
Great question. So if they're canned and they've already been cooked, you could just rinse them twice. If it's fresh, it hasn't been cooked yet, then you're going to rinse them and soak them overnight in their water, pour out that water. So let it soak for like at least 6 hours and then do a new batch of water and let them soak again. So you're going to need some more time for that. And
And
then
do
you
you
can
like
toss that water out and cook them.
and do you like water or salt water? I've heard both things.
Um, yeah, I work with a fair number of people I work with are very salt sensitive, so I would just say water. You could experiment though. If you aren't salt sensitive, I don't see any reason why not. I don't remember or know that salt does anything specifically helpful for legumes. What are your thoughts on that?
I don't know. It's I mean maybe it's just been a taste thing, but
Yeah,
yeah, I mean that's how my wife does it, so I'll have to ask her.
perfect.
Great. This is wonderful. So then in terms of coming back to the food, so what does then breakfast look like? I mean, do you have to cook every breakfast, or are there ways to kind of get these leafy greens in a way where you don't have to always cook every breakfast?
Yeah, that's a great question. So let's talk about it because some people travel a lot or you get surprises and you're not, at home or you just don't want to be bothered with cooking. I tell people hit the easy button where you can. These days, certainly here in the US, in many supermarkets and stores, it's really easy to get already washed and prepped greens, particularly salad greens. This is just a game changer. It's revolutionized a lot of things and it's made it easier for me to prescribe a healthy nutrition that is mobile. You don't have to be at home to make this work. So even if you're traveling, you can have Instacart or something like that deliver it for you. Um, the basket of the box of the salad greens is $3, $5, $6, depending on the size. And you just grab 2 or 3 handfuls, and make it part of your breakfast plate, right? So your breakfast plate, even if you're traveling or if you don't want to cook, can be, 2 to 3 handfuls of these leafy greens partnered with, let's say, boiled eggs, or nuts and seeds. Maybe you brought those with you so that you, again, can limit the wild cards. Maybe it's the sausage that the hotel gives you as part of the built-in price you paid for your hotel room. However it is you're eating, whether you're plant-based or not plant-based, you can absolutely make this work. If you have access to fresh fruit, why not have a piece with its skin on? So apples, skin on. Bananas are a really nice choice. Berries are great. They tend to be blood sugar friendly. Like there's some people who have blood sugar spikes from bananas. Okay, you can swap them out. Focus on your berries. If you're gonna have peaches, apricots, skin on, please. The skin has fiber and other nutrients to offer to feed your gut's microbiome to help that blood sugar regulation be friendly. There's a lot of ways you can work around this without having to spend hours and hours cooking.
Excellent, very helpful. So you talked about how sometimes people are skipping lunch because they're very busy.
Mhm.
What about skipping other meals, like skipping breakfast and doing some intermittent fasting?
Intermittent fasting can be really helpful, particularly when it's done well. Historically, certainly ancestrally, for all of us on this planet, as humans, we've always grown with periods of time of feast and famine. It is a natural part of the rhythm. For some of us, based on our religion or spiritual practices, fasting may well be baked right into the culture. Great, I'd say lean into it and follow it. I feel like in today's world where we have such an exposure to highly processed, ultra refined foods, and maybe a lack of density of nutrient density, it makes sense to do intermittent fasting because intermittent fasting invites the body to remember and restore insulin sensitivity and to give you a real tool that helps you deal with and break up issues with that metabolic flexibility and insulin resistance. So I think intermittent fasting is great. I think that you could do it and find a eating window that works for you. So that way you aren't getting yourself into trouble with what's appropriate. Some people do well with an 18-6 fast. Well, let's say they eat at noon and their eating window starts at noon and they end at 6 p.m. Other people, it's going to be maybe a 14-10, right? So they start at 10 a.m. and they'll stop eating like at 6 p.m., whatever the logistics are for you. Um, Pregnant women, breastfeeding women should never fast. That is not the time of life to be fasting. And religious and spiritual practices absolutely talk about that. Like this is known for humans. That's not a fasting state. You just don't want to do it. It's metabolically too demanding. Other than that, I think it's great. It's a simple, easy healing tool because you're not eating. How simple is that?
Yeah, and I think that both the dietary recommendations that you made and then also fasting, they're kind of changing the way that we're using fuel, or we're using different fuel in the body, right? Because you talked initially about glucose being a major fuel that we use, but sometimes metabolically, it's actually not the best fuel. So what other fuels do we have in the body that we can use instead of glucose?
Yeah, so we have glycogen, a storage backup form in our liver. And if we are in a fasting state, if we go into ketosis, because we're doing a keto program, we're going to tap the stores of fat that exist in our liver, or we're going to tap the stores of fat that exist in the abdominal area, the belly area, right? That visceral around the organs and in the organs fat. We want to tap that fat because it's troublemaker fat. That particular fat gives off inflammatory products, really cytokines that are just trouble. We have good kinds of inflammation. Like if you get a paper cut on your finger, your body responds to that cut with healing cytokines, healing inflammatory markers. We want that. What we don't want is the ones that cause the heart attacks, the strokes, that interfere with the flow of blood and other goodness to our brains and can set us up for things like dementia and Alzheimer's, damage the kidneys, etc. That inflammation, it can be a real booger, but it's worth getting in front of it so it doesn't hijack really your ability to live long and live well and enjoy your life, you know?
Hmm. Well, this has been absolutely wonderful. So for people who are listening to you and they're like, man, I really want a CGM because I want to see what my blood sugars look like. They've got diabetes maybe or pre-diabetes, and they really want to work with you. Where can they learn more about you and do so?
Sure, sure. They can go to my websites. We're between two because we had some issues with one contractor. So they could go to naturalhealthcare.com, spelled just like it sounds, naturalhealthcare.com. And they can also go to my name, DR, like the abbreviation for doctor. So DRBEVERLYYATES.com and get more information about that there.
Excellent. And we will put those links into the show notes as well. And you have 100% virtual practice, correct?
Yes, it's 100% telehealth. I had adopted telehealth back in 2009 because some of my patients at that time just traveled so much. They weren't always able to get in person to the clinic, right? They were all over the planet. And as that technology became more mature and available, I was able to get some people on board. Some people didn't want to do it. And then with the pandemic, everybody's like, I need help and I need it now. So that really has changed it. And now they love it. It's just so interesting how things can change over time.
Yeah, that's yeah, it's so important um, that people have access. So that means you can work with people all over the world. Is that correct?
Yes, because in this case, if they're outside of this area, then we can have more of a health coaching relationship and take it from there. The things that I am suggesting are all in the lifestyle realm anyway. If someone is on prescription meds, and this is just, it's both the legal requirement and I feel like it's the moral, ethical requirement. If you aren't the health professional prescribed it, you don't unprescribe it or change it. You can certainly educate this person about what it's doing, potential interactions or side effects, but it's not yours to mess with. So I always tell people if you're on meds, whoever prescribed them is the one you need to have that conversation with. Meanwhile, we can help you with your nutrition, your stress, your sleep, get you going with your meal timing, and help you think about what's appropriate for you for exercise and strength training. And if you're injured and in pain, don't despair. We can still work with it. It doesn't have to be that basically become an Olympian. That's not a requirement.
Excellent. Yeah, I'm 100% virtual as well, and I think it's a really great service to people who can't find the help where they need it.
Yeah, there's a lot of people who are basically in health deserts. We don't talk about it like that, but that's what it is.
Yeah, agreed. So you have an exciting event coming up.
Yeah. So we have the Reversing Type 2 Diabetes Summit 2.0. We're back, baby.
Woohoo!
And Dr. Evan Hirsch, he is one of our amazing speakers on that summit. In fact, his particular episode, right, will be live on May 10th. So do check the summit out. Please come join us. It is free during the time period where it's available and open for everyone to come and get that information. And if you want to purchase it, that helps to support this work and to make sure that we have the money in the bank so that we can go and continue to promote and do these kinds of things. And so everybody gets to be healthier together.
Brilliant. Dr. Bev, thank you so much for joining me today.
You're very welcome. Thank you for the invitation. I appreciate it.
So if you have chronic fatigue, long COVID, or mast cell activation syndrome and you're looking for help, check us out at energized.com. We have a program for almost every single budget, and we're here to help. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.